Welcome to the Practice Brave podcast. I am the host, Brianna Battles, founder of Pregnancy and Postpartum Athleticism and CEO of Everyday Battles. I'm a career strength and conditioning coach, entrepreneur, mom of 2 wild little boys, and a lifelong athlete. I believe that athleticism does not end when motherhood begins, and this podcast is dedicated to coaching you by providing meaningful conversations, insights, and interview topics related to fitness, mindset, parenting, and of course, all the nuances of pregnancy and postpartum. From expert interviews to engaging conversations and reflections, this podcast is your trustworthy, relatable resource for learning how to practice brave through every season in your life. I'm excited to let you know that enrollment is opening in October for the Pregnancy and Postpartum Athleticism Coaching Certification. You can get on the waitlist now to have access to a $500 coupon that you can use between October 12th and the 16th. I completely updated this certification course in early 2023. And so now it includes 10 modules, all of coaching information on how to effectively coach pregnant and postpartum athletes. There's 20 expert interviews, exercising programming templates. You will be listed in our coach directory after completing the certification. And we give you plenty of ideas and options for growing or expanding your coaching business. I would love to have you join us as a pregnancy and postpartum athleticism coach. And you can get on the waitlist by using the link located in the show notes, which is briannabattles.com/waitlist. Hey everyone, welcome back to the Practice Brave podcast. Today I'm here with Carrie Pagliano. She is a pelvic health physical therapist, and she helps so many different people manage pregnancy, postpartum, and any kind of core and pelvic health symptoms. She's kind of my go-to PT when I'm pissed off about something, when I need a first line of defense, someone to refer to, or if I have a question about something with a client, I send her a text. And recently we were having a conversation and I was like, I'm mad. And then she's like, you know what? I'm mad too. And we thought that it was time to bring her on the podcast again to talk about all things pelvic health and what we've seen evolve over the last decade. And then honestly, even within the last 3 to 5 years, when it comes to the messaging around pelvic health and female athletes, what they're told about incontinence, prolapse, etc. Things have changed, and we have sort of been part of that change and watched it change culturally. So Carrie, thank you for being here.
Thanks for throwing up the bat signal. I'm here for it.
Yeah. So tell us a little bit about yourself for those that do not know you.
Yeah. So first and foremost, wife and mother. I've got 2 kids that are 9 and 12. I've been in pelvic health for 25 years now, which doesn't make any sense at all. And have my own practice here in Arlington, Virginia. I've had that for 5 years. And I've kind of navigated my own issues. I was that PT that I worked in pelvic health for, 13 years before I got pregnant. Thought I knew what I was doing, has been a runner all my life, and realized that I was sorely mistaken after the fact and really couldn't find that bridge between what I was teaching other people and sport. And kind of like you, I wasn't going to take no for an answer and was going to kind of figure out my own way. And somewhere in there started doing CrossFit too. And so it's been a lovely journey combining what I love to do physically, which is run and be active and that kind of stuff. And then also really push my field forward because there isn't a lot of research. There's not a lot of stuff that we know. We need to bastardize a lot of things that we take from other areas like sports and orthopedics. And that's just fun. And it's fun when you've got somebody else as fired up as you and throws up the bat signal and we're like, let's fix it.
Yeah. I think what's been frustrating for me is I haven't experienced pelvic health symptoms, but what I've experienced is being awakened to the significant lack of support, understanding, and resources that women in general have during pregnancy and postpartum. And then when there's something, quote, wrong with their vagina, then there's really no information, understanding, et cetera. It's really taboo. It's really shameful. And it can affect every single part of their life, not just their fitness, but their intimacy, their body image, so many different factors where it feels like motherhood has now robbed them of something that is so intimate, that is so sometimes even embarrassing to talk about. And it was through these different DMs and messages that I've been getting through the years that it's just like, this is a significant problem. And it's not just pregnant and postpartum women. This is a women's health issue. And even within that, what we have seen is really conservative treatment, women being dismissed or given like ridiculous guidelines to live their life within, or the other extreme of just like, you know, we got to live with it or ignore it, or like, no, like that doesn't happen. It's not that big of a deal. So like either way, there's kind of like dismissive experiences. And that makes me mad as a woman.
Yes. Yeah. I mean, yes to all the things. It's so interesting. We're at such a poignant part. I think there's a culmination of, I think more women are vocal about stuff. I think especially a lot of our pro athletes in the, you know, just women athletes, period. In the running space, we've had a couple amazing books come out this spring. Lauren Fleshman, Kara Goucher, Des Linden, all talk about just like their experiences as, you know, youth athletes and dealing with nobody wanted to talk about periods. Nobody wanted to talk about this in relationship to, you know, pelvic health and you know, bone health and all sorts of those things. And then, you know, more women getting pregnant, talking about it, sharing their experiences on social media. And then, you know, the travesties that are happening, you know, I can't remember the sprinter's name. What was it? A week or two ago, she died in pregnancy and wasn't found for 3 weeks. Like, what the hell is going on? And so wrapping your head around all that right now, it's like, okay, it's going to change.
Yeah, like it's 2023. How do we not have more support and more informed approaches to the changes our bodies experience during these seasons? And you know, something I keep freaking saying forever is like, we are not fragile and we are also not invincible. So where is this line of really having a better understanding of maybe what we're predisposed to through these seasons, whether it is medical predispositions or core and pelvic health predispositions, genetic predispositions, whatever it might be, like getting a true inventory of our body so that we can make better choices at an individual level about training, about birth, about recovery, about getting the right support systems in place. But we're up against a lot of barriers.
Yeah. If you haven't read it already, Christine Yu just came out with Up to Speed. Basically, it's history of female sport. And it's amazing kind of cross-generational view of how the hell we got here, basically the patriarchy. And then, you know, all the changes and questions that we continue to have, a lot of them around hormones, pelvic health, and that sort of thing. And she shares a lot of stories with athletes. It's a great book. I love that we have to look back in order to figure out where to go, but I do see signs of hope. I had a client recently that I had treated her mom years ago, and her daughter's now 18.
That's like kind of weird.
It is that awesome. because I'm 12, right? So
you've been in the game, girl. You've been in the
game. And so her daughter is, you know, just finished first year in college and is having inability to have sex. And her mom is like, hey, I know this is, you know, like, can you see her? I trust you. And it was so cool. She came in and she's talking to me about, hey, this is what we tried to do and this didn't work. And of course, you know, background was a dancer and kind of all this stuff. Like, so it's very classic, like overactivity sorts of things, very classic dyspareunia. But the fact that we got to it so early because she had this open conversation with her mom who was aware of where to go, aware to like, hey, there's help for this. And, you know, it's funny because my daughter's 9 and this girl's like 18. And so I get to see where I'm going and what relationship I'm trying to create with my kids about, I want us to talk about this. And so right now, my daughter, we're talking about periods and hormones. And I had a dad the other day at the pool, like his daughter who's 14, she's slowing down. And he's like, yeah, she just seems lazier now. I'm like, no, it's her freaking hormones. Like, the hell. So I feel like, I feel like at least we're starting to have those conversations. There's those glimmers and there's places to point people, but the prevalence of just misinformation, lack of information, not knowing where to find trusted information, I think continues throughout all of this as well. And that's probably one of the hardest things is you're sitting here being like, I know I need to do something. I don't know where to start.
Right. And I think what I'm seeing And what's reflected in so many of the emails and messages I get is like, I know enough to know that what I've been told is not correct.
Right.
I know that. And I also don't know what the next right thing is.
Yep.
So how do I figure that out? Who do I talk to? How do I get a better idea of what I actually need? So maybe they had a really significant tear. They're having a lot of pelvic health symptoms. Maybe they think they have prolapse. They're seeing something. They're feeling something. Like, what is this? I know that you've talked about this. I know that this is not, quote, normal, but also my doctor told me it's normal, or also my doctor cleared me to run, or also this, or my PT told me I can never squat again. Like, they're told really limiting information, and we know enough to know that that's not accurate, but also don't know what the alternative is.
Right. And there's a whole bunch of things to kind of unpack in there too, common sense wise, like somebody telling you not to squat and now they're fearful of squatting. But then when you say to them, when you sit down on the toilet, that's a squat, right? And they're like, oh yeah. So like in the midst of fear, you kind of lose a little bit of your logic and your sanity because you have this person in a position of power and authority telling you not to do something. Mm-hmm. And on one hand, you're like, all right, well, I know this, but then this person is telling me that. And so there's really kind of a challenge of authority and like, who do you trust? And could it be that this person, this physician may not know all things? And again, it's kind of stepping back and reframing where you should expect to get information. And I have some amazing OBGYNs that I work with. I have some amazing friends that are in that field. My expectations for them are, in that postpartum visit, you're going to make sure that I'm not spewing things that should not be spewed out of my body. You're going to make sure that, I'm not having postpartum depression as much as possible, making sure that they're going to make sure that you've got birth control, even though sex is the last thing on your mind. That's what you should expect. Do not expect your OBGYN to understand the minutia of your workout. Find the person that would understand that and appreciate that. But I think the other thing that's incredibly confusing, and we talked about this a little bit before we went on, was how fast things are evolving. Mm-hmm. And that's what I love about being in this field is if I have a client that I haven't seen in 3 years, I got a whole new barrel of stuff to try with her, things that I know now that I didn't know then. And we were just saying that the last 3 years, especially, I know I'm treating running incredibly different. I'm treating pelvic organ prolapse incredibly different, considering the role of overactivity. I dare say the majority of our patients have overactivity related to their pelvic floor issues. Whereas when I first started 25 years ago,
athletes,
right, 100%, 25 years ago, your only criteria was pain with sex. Mm-hmm. And when people hold on to that and they're like, oh, well, you don't have pain with sex, you can't possibly have that. I'm like, no. What about this and this and this and this and this? Mm-hmm. And so the more we learn, I think it's more important to find a provider that's willing to critically think and problem solve with what is going on and pull that stuff together, other than being like, hey, this is the algorithm for pelvic organ prolapse. Like, it doesn't work that way anymore. It just doesn't, because we know so much more.
Yeah. I mean, that's why I feel a little crazy, but that's why there's been in 6 years, 3 iterations of my pregnancy and postpartum certification.
Yeah.
Like, how is this not industry standard? I know that I seem like maybe a little neurotic, but things change, and my coaching and my deliverables of this is how I would say it now. This is how I would advise them now. And honestly, just the reps of working with people in real life, get rid of the evidence for a second. There's so much we learn from actually working with a runner or an MMA fighter or a dancer where you're like, I don't know if the evidence supports this, but it's freaking working. And we are the people that are actively creating the evidence, and the evidence comes out a little bit later, that kind of confirms what we're doing a little bit later. And that's not to say that we can't use evidence to guide our choices now, because again, we have more and more things coming out. Our field is changing rapidly, but at the same time, we have a huge opportunity as being the people that are actually seeing the people.
Yes.
Not just going off of theories. We're actively in the trenches. Yeah. We're creating this evidence.
Well, and I think, I've always been one that if I'm going to make a decision, I want to understand kind of what the other side is talking about. And I don't think people realize, I don't remember the exact number. It's like 13 or 17 years from the time that research is published to the time that it's incorporated in standard of practice.
Holy shit.
I don't have time for that.
Say that again.
It's definitely over 10 years between time of publication to incorporation in standard of practice.
So for example, that is why when your provider may tell you don't get your heart rate over 140 beats per minute, for example, during pregnancy, that was outdated years ago.
Mm-hmm.
Like what was like the 90s? Early 2000s where that was outdated?
Well, and here's the other thing too.
It's still being communicated in 2023.
I've been on multiple committees writing for specialty board exams and even for the basic licensure exam for my profession. And for a study to be incorporated in an exam, you can't have studies any more than 10 years old. So that's a lot of change right there. But you can use textbooks to refer to for the question. So when item writers write a question, it can come from a book or a study no more than 10 years old. But I think it can't be any earlier than like 3. It can't be like it just came out yesterday.
Yeah.
And for a study to get in a textbook, it's going to take 3 to 5 years for that to happen. Then the book has got to get published. And then if I can only have books that are up to 8 years old, like do the math on that one too.
Yeah.
And so when you understand that, then evidence informed as opposed to evidence based, I think has a little bit more context. And again, when you understand research, especially in sport, the prevalence of females as research subjects, the limitations on pregnant women as research subjects, the limitations on like heart rate and like, which has been such a barrier for our professional female athletes. Like once you understand that, you're like, oh, okay. And you can be pissed about it, but I'm like, I'm not going to go get my PhD anytime soon. God bless the people who are, but in the meantime, knowing what I know about that, I've still got to deal with this person in front of me. And that's where, again, I think it's been such a blessing having more viewpoints. And that's what I love between like the collaboration between coaches and PTs, because we all look at things from a little bit different way. We come with different skill sets and we can kind of walk around something and navigate it. If you're coming at it with just that linear lens, you're going to miss a bunch of stuff. And so again, having background in other areas and also doing those sports yourself.
Yes.
I think there's so much to be said about bringing that forward and speaking. I mean, you talk so much about athlete mindset and like, that's such a thing. Like all of that contributes to how we have been moving this ball forward.
Oh gosh. Like when I think about a lot of people say, well, the ACOG says that exercising during pregnancy is really healthy and safe for mom. I'm like, yeah, man, like we know that. Like we have known that. And people try to use that as a way to like justify however they're choosing to train. My doctor told me it's fine to keep doing this, Y, or Z, or keep doing what I've always done. The ACOG supports it. And at the same time, what's not reflected there is core pelvic health, long-term athletic performance, which is the shit that like actually kind of matters for the quality of life for our female athlete. They don't need to be convinced that it's healthy for them. Like we know exercising, unless there's any kind of contraindication, is healthy for mom and baby during pregnancy and into motherhood.
Yep.
We freaking know. But there's a big disconnect in taking
what does that look like?
Healthy and safe. And also like, what are the other considerations? And that's what, my business has done for 8 years, but it still is that reflected in mainstream research?
Yeah.
Not yet. We're getting doses of it. And I think what we've really tried to focus on between your field and my field is how do we connect the dots between like the physiology, core and pelvic health, and like the psychology, and then the long-term athletic performance. Like that is how I've connected dots to know what are we prescribing as advice, training advice, navigating through pregnancy and postpartum. It's like, let's look at those 3. Because if we're not looking at those 3, we're missing significant pieces of the puzzle.
Oh, absolutely. Absolutely. And I think, the sooner we can have those conversations. I was talking to somebody earlier today about, when do you start those conversations? And I love having them even before women get pregnant, because let's start working on that mindset piece.
Yeah.
Let's start, because lots of times it's such, I mean, mental health obviously is such a huge piece of this as well. And a lot of women use their activity and sport to manage that and see that as part of their identity. Like if you don't recognize that in a conversation with the person you're working with, you're missing so much of it, what that means to them.
Right. Because they'll make choices for their training and their body that's from a place of scarcity or
right.
ego or fear or insecurity. And
Yes.
like we self-sabotage, and I certainly have in multiple times in multiple seasons of life, but it's all from that athlete brain versus a athletic maturity perspective. How can I look at this from a more enlightened or mature version of myself versus my like instant gratification of pushing boundaries or of almost like proving something to myself or other people, or this fear around my body changing and then trying to control it, or on the other postpartum, trying to control how fast you get back to any kind of baseline. Like there's so much ego, and not even in a bad, but it's just our egos. Like they drive so much of our choices. We don't address that freaking early before your whole life and body is about to change. Like it's going to make it a harder thing to navigate when you're already in it.
You can, and here's the thing too. I mean, I think you can even navigate that as just a human.
Right.
And then when you get pregnant and postpartum, not be able to put that in that context. I find that a lot here in the DC area. We have a lot of older moms, being one of them. I think I was actually a young one for around here. I think I was 34 when I had Gianni. And just you have this fixed mindset that you can kind of control everything. And I think first time around moms, whether we verbalize it or understand it or not, we feel like we have something to prove.
Yes.
And it's a damn shame that of all the things that we have on our plate, that's one more thing that we feel like we need to do. And I think usually by the second, I see glimmers of, less F's to give. But if you're not considering all that, and then throw on if you're having symptoms or you're having, you feel like you Google prolapse, like you put those two things together and you've got a mental health shit show.
Right. Because I feel like, you're right. Like that's a really interesting point. As a human, like I had Kate at 27, like who I was as a human and how I was living my life and my thought processes and my choices, how I was spending my time, like everything from 10 years ago is dramatically different. How I think and operate, spend my time, what my training looks like, everything is dramatically different. Yes, there are some similar themes. Who I am, what I like, what I do. I've always been my wiring is consistent. What that looks like is very different at a human level. And then you're right, you add the element of like mom or athlete and expectations on top of that, and you go through a significant evolution.
Yeah.
But there's a lot of maturity that's gained over the course of any 10 years, just like when we look like who we are between 16 and 26, like you're clearly a very different person, and who I am now between who I am when I'm 50, it's going to be a very different person. Yet that's not factored in when now we're adding a whole baby, a whole other person to come into our life that we're now very responsible for. It's no longer just about us.
Oh, and by the way, you're not sleeping. You have to limit what you eat because it'll mess with their poop. You've got hamburger nipples. You can't lose the baby weight. Oh, all that other stuff too. But, I digress.
Yeah, it's really hard. I've seen it like my sister just living it so closely with someone this year. Today is actually Theo's first birthday.
Oh.
I know. And it's just been such a fucking hard year for her, man. Like, and Desiree and I are very similar. Like, we're kind of like really rigid in how we are, and we got to learn things the hard way. But it's been such a steep learning curve of like, how do people do this? How do they balance working full time and exercising and my changing body and my ability to even try to work out, and like how I feel, and then his feeding, and like just all the issues that can be attached to having a baby that struggles in different areas, like whatever it might be, from nursing to food, whatever. It's just like that first year And I don't miss it. Like, I don't miss,
Mm-mm.
I
Mm-mm.
love, like, give me a 1-year-old. But like before that, hell no. Like, no, it's too hard because they are 100% dependent on you. You know, like if I could like birth like an 18-month-old, I'd like maybe go for it again. But
You
that,
know,
I
I
hate
might
being
just,
needed like that. I hate being
no,
needed like
yeah.
that. It's
My
too hard.
oldest didn't sleep, so no, I don't need to go back to that. But
Yeah.
no, you've mentioned to me multiple times, like just how hard it's been for your sister. And I mean, that has to like knowing that you're in this space and trying to make so many changes and feeling like, yeah, we're finally moving things. And then you turn around and and she's got you, like,
She
that's got to
has
be harder than hell. Like,
without me being in the same state as her, she at least has access to a lot of knowledge and
right.
education. And even still, what she's been told by her doctor, what she's been told by a Euro guy, what she's been told by a pelvic PT.
Yeah.
Like, I'm just like, and Desiree is, she has her doctorate. She's a very smart lady who really cares about research. Here's the freaking problem. The research isn't reflective of like what we actually know yet,
Yeah.
and so it's she's like she needs to hear it from someone who's not her sister. So I'm like, so talk to Carrie. She'd be a
Yep.
good point person for you. Or hey,
Yep.
come. When she was in Idaho, I had her go to Mindy, one of our calls,
Yes. That was
and Mindy
great.
was incredible because I was like, she needs the reassurance from
Yes.
literally an internal perspective and
Yes.
like the delivery of information, and it cannot be from her sister. It does not
No.
freaking matter that I can do this with professional
Mm-mm.
athletes
You're still
all
13 in
day.
her
I'm
head. It's fine.
still a bitchy older sister who knows everything and is constantly telling her what to do. Like, that is what it comes down to.
Hmm.
But if Desiree is still facing these barriers
Yes.
and she has access to someone who can like dispel a lot of that shit, like
Yeah.
the majority of people are living similar experiences to her, at least in a couple categories, and have no idea what to do.
Hmm.
No idea who to turn to, no idea what's actually right versus not, what their training should look like, what is normal for their body or not
Yep.
normal, and then what to do about it. They
Yep.
do not know.
Yeah.
They don't know.
Yeah. And I think it's so interesting when I think back because this wasn't a conversation and we talked about, how so much has changed and it really and this is somebody asked me today, they're like how we met and I don't remember, I'll be honest. And I'm like, we still have never been together in the same room, but it's all good. But we kind of because our kids, Kate is just I think a year younger than Analia.
Yeah.
And I feel like we were kind of coming up in a similar space in time in which you had these pockets of active women and we had pockets of providers being like, hey, we got to do better here.
Mhm.
And people don't realize that. I mean, Kate's what, 8? Annalie is 9.
He'll
Like,
be 10 this
oh, he will? Oh my
this
goodness. I'm
yeah,
making him younger. Okay. So when's his birthday?
June 25th.
Oh, well,
Which,
happy birthday, Cade.
oh my
Oh,
God.
he's older than Analia then. So Analia's birthday is she'll be 10 in September. So yeah, we're coming up in this space and not only trying to find solutions because of our work, but because of this is what we're kind of going through ourselves. And people don't realize these were not conversations that we had. When I was working with a runner, first of all, I wouldn't have worked with a CrossFitter like 13 years ago
Right,
because
it wasn't fully even a thing, and
well,
moms
first
weren't doing it as much.
in 2013, like
Yeah,
PTs and CrossFit was like this
awesome.
anyway. So,
Oh, I
PB nearly,
remember. I'm certified through NSCA, so I remember that
so
whole
yeah.
and
Um,
doing CrossFit and knowing like that I was doing CrossFit what in 2009, 2010? Like, it was
yeah,
wild.
so
So long.
you just being in the gym doing a thing was enough. Like
Yeah.
having a female doing the thing. And then okay, someday you're going to get pregnant and have a kid and now like that's the thing people don't realize is these
Yeah.
things were not happening. Like women were
Just
running
10 years ago.
barely running marathons in the late 70s. Like I'm a child of the 70s. Like they weren't doing it.
Yeah.
So we've got an evolution of practice that it's not ideally meeting the demand, but we also have such a change in how active women are. Like I talk about my mom all the time. My parents did not like, they built our house. We got wood for the house. We gardened. Like it was very kind of like Little House on the Prairie. They started running to keep up with me, to find me on the cross country running course. They started Nordic skiing to find me on the ski course, and then kept going after I went to college. My mom started going to the gym before work, which is freaking revolutionary. I mean, your mom's a badass, her 1.5 million hits on her,
wow.
lifting her 200-pound
helping me go viral, Mom. First,
right?
Like at that volume, that's for sure.
Right.
But it's true. Like our mother's generation either is not very active, or they got a later start, or if they were doing it when we were younger, it was probably very aerobic based.
Yes.
There was a very small handful of women that were pursuing any kind of weightlifting in the 70s, 80s, and 90s. Pretty small. And then pregnant athlete, quote, like that's copyrighted terms because that became a thing within the last decade when I started writing about this. Postpartum athlete, this was not terminology that anyone used until I started creating programs and like writing about it and kind of like, how do I label what this population identifies as? Because we're not just pre and postnatal. Like that's freaking lame. That's why it never resonated with me. Like anything to do with pre and postnatal exercise, I was like, that's freaking dumb. Like that is so dumb. We are not like these fragile people that need all these different unique considerations. That's never resonated 10 years ago. And freaking still, I see some stuff and I'm just like, oh my God.
But that's what we were taught. I mean, first of all, I got none of that in PT school. And so when you went off and did stuff, it was very diagnosis specific. It wasn't, how to manage this stuff through the lifespan. It was very kind of, this is your diagnosis. We do this number of treatments and blah, this is it. And it didn't match up with the shift that we were experiencing.
Yeah.
And so I think that's the thing that really has to be highlighted. I mean, I was talking to a PT student in February and she was second year and she's like, oh, I'm on a clinical, it's pelvic and ortho. And I'm like, you don't realize that these two things were never a thing together when I first started. I said, you're starting 15 years ahead of where I did.
Yeah. And she's starting 15 years ahead of where most PTs are practicing.
Well, exactly.
Pelvic health lens only of like, we're going to do Kegels and we're going to like hold and like, there's a place for that, of course. But like, then being able to like, look at like all the other things that complemented ortho, neuro, sport, being able to take like bits from different practices, right?
Yes.
And then being able to incorporate it into like a holistic approach to helping a human, which is coaching 101. That is coaching. That's coaching.
Right.
But I think PTs tend to get really specialized and get so zoomed in there that we're not zooming out to actually help people.
And it's getting more so, I'll be honest. There's a lot more PTs that are, going straight into pelvic, which I personally don't agree with, because I feel like you need some context from some other areas and you're missing kind of this whole thing. But that's where, again, I think the collaboration with coaches and trainers who have that different background to be able to kind of mash this stuff up together. And again, look holistically. We talked about the mental health piece before and kind of the mindset and all of that. Like, it all has to be part of it. When I started PT school, this is not at all what I thought I would be doing. But in retrospect, being able to address all parts of a person's lifestyle, their day, like how they, not just be like, here are these exercises and do them. Like, hey, guess what? You're having trouble getting to this. Let's figure out where is the best part of your day. Why don't we get that set up? Like lifestyle sorts of things, habit building, like all of that stuff to encompass that. Like, that's what providers need to be doing, having that network of, okay, when you're done with this acute stuff, I can pass you along to Katie Macris, and she's going to help you get ready for, your triathlon, and Coach D, and she's going to help you get ready for your marathon. Like having that continuum is so freaking new, but it's such a gorgeous thing.
You're right. It is happening in like small pockets where we're able to really collaborate and refer people. We have we have over 3,000 coaches around the world.
I know.
Like we have grown astronomically with PNPA coaches who maybe they can't solve all the problems, but they're going to help you filter. Like they, if nothing else, can help you filter, like what is the next right thing?
Yes.
I don't have to understand or participate in dance in order to be able to help a dancer. Right. You don't have to do CrossFit in order to know how to help a CrossFitter, at least from like a a very basic level that, you know what, they're certainly not hearing from their doctor. They're not hearing from their CrossFit coach, and they're probably not really hearing from their physical therapist either. So how
Right.
can we filter your next right thing? And that is,
Yeah.
I think, truly what the art that pregnancy and postpartum athleticism coaches are bringing to the table is like, we can filter and guide to help triage what has happened.
Yes.
Like that first line of defense, collecting information and saying, and this is what we can do with it.
Yeah, no, I mean, and I love problem solving that way. We're like, let's see what we've got. Let's see what resources we need to bring in. And if you,
I DM you all the time.
I know it's all good. I like it. No, like otherwise you're like throwing darts at the dartboard and hoping they stick. And that's where you get frustrated, and you get patients that spend 5, 6, 7 years down the line and they can't find what they're looking for.
Not to mention thousands of dollars that they probably don't have in order to figure it out. And like, that's where I started at this point 8 or 9 years ago, where I was like throwing money and time at so many different people where I was like, this is dumb. They don't get what I do. They don't get my body. None of that makes sense from like an anatomy and physiology perspective or a strength and conditioning perspective. Right. I know enough to know that doesn't make sense. And that was like 8 or 9 years ago where I was saying, this doesn't make sense. That's not how muscles work. That's not how tissues work. Why is it being presented and guided this way when like you still have a body and I know movement, so it never made sense. It's just interesting. And I know we just recently talked about somebody who is living out of the country and is up against a lot of different barriers between like, she knows enough to know this is not accurate information that I'm being given, but also what's my next right thing?
Yeah. And I is that from Encanto? I swear to God, that's from a Disney movie. I don't know what it is. Anyway, point being, I was thinking as you were saying that, like, I would almost prefer to be ignorant than know, oh my gosh, there's an answer here. And I just don't know how to find it or get the resources and that sort of thing. And that's why I think, you and I probably spend so much time in DMs and emails and that sort of thing, just helping steer people in the right direction, because it is just an absolute freaking gift and privilege to be like, okay, if I tell you a couple little things, it's going to get you going in the direction that, one, could save your mental health, 2, that could get you where you're going, and 3, once you get there, you're now going to have that information to be able to pass it along to somebody else. And so it's like a grassroots advocacy piece where you're like, okay, I'm going to help one person at a time. But I think, again, with social media, the world is this really small place. You have to be aware that there are variances. I'm very fortunate, when I was in the Academy of Pelvic Health, to be a delegate to the World Congress for Physical Therapy and have conversations with physios from Saudi Arabia that were literally just trying to get women recognized for basic treatment. African countries where you're just trying to get basic education out, not to mention fistulas and kind of all that other stuff too. Like, I think when you understand just the broad expanse of where we are, it's like, okay, where this person was, she was able to get some care on a regular basis. And we don't want to discount that, but we want to leverage what's good about that to match the situation, but also help that person feel empowered to say, you know what, knowing what I know and been educated on, I'm going to use this local resource here for this because that's helpful for me. I may want to omit some of this other stuff because it's not as up to date, but how else can I kind of adjunct this and move this along and not have to do it alone, though, too. Like, it's hard. I mean, I'm learning something new every day with every new patient. That's the thing people don't realize. I'm like, I don't have all the answers. I've just seen a hell of a lot of patterns. Yeah. And I can have a pretty good idea how this is going to play out, but I don't know. Find somebody that is used to that. And that's where kind of your resources can be incredibly helpful, is like, find those people that resonate with where you're coming, or not trying to sell you a bunch of Kool-Aid, but helping you work with what you have and help you find that path forward.
I think what it comes down to is people need to be seen and heard and validated at like every level, but especially during seasons like where they feel like something's wrong with their vagina. Like it is so, I have seen that. Like people are like, I don't even know how to communicate this, but it's so embarrassing. And I don't want to feel like I have to hide this. And I can't even talk to my husband about it. I can't even talk to my partner about it. So to be able to have a coach or a practitioner that can give them some kind of light to light the way is so critical, because it can be a really lonely and dark place. And and it can just fuel an array of like mental health struggles that then translate into exercise struggles and relationship struggles, and like all these struggles. And the root of it is just not being seen and supported and understood during such a vulnerable season in your life.
And here's the thing too, is again, it's not just isolated to that early postpartum period. Like this was probably a month and a half ago. I had started to shift more protein, had forgotten about my fiber, and all of a sudden nasty little hemorrhoid and prolapse symptoms. And I'm like, I know better. And then once that starts, you're like, how do I walk back from that? And you still want to be active and you still want to do the things. And okay, well, if I do this is going to make it worse, but I don't want to just sit and do nothing. And like, that's the thing I want people to understand, is there's those of us that like, we've been in this space for a long time, and it's still hard for us with what we know to navigate those pieces of it. Don't try and DIY it. Like, I literally had to step back and be like, all right, if this is your patient, what are you going to do? Because you question everything and you're like, oh my God, if I tell people, then they think I'm, an awful therapist. Like, we all make mistakes. We do these stupid things. Right?
Oh, gosh, it's so true.
Literal pain in the ass, by the way. We're all better, but literal pain in the ass.
I mean, like we preach this stuff, we educate on this stuff, and then still walking it yourself. For me, it's so attached to like the athlete brain conversation.
Yeah.
Like I know athletic maturity. I have this, I can zoom out. I know exactly what I would tell my athlete if they were in the situation I'm currently in as an athlete with my jiu-jitsu stuff. And all of my toxic bullshit comes out. And I'm like, God, I thought we were past this. I really thought that I had this under better control, or, that I wouldn't like feel things this way. This is so brief from 10 years ago. And here we fucking are, like, but I think it is a solid reminder of like, you can know and still struggle to make certain adjustments, or to like navigate the hiccups that are inevitable when you try any new thing, when you change any new thing, when life changes, when seasons change, when your body changes. Like we become very adaptable. We just have to know how to like zoom back out and like navigate instead of being like so zoomed in. But it's
that's an amazing point, because one of the things that I am not one of those PTs that I need to be somebody's person. I was like, my goal is for you to advocate for yourself, for you to have a triage plan. And then if things go really wrong, then you wave the flag and I'm there. And it's one of those things where I want you to be able to triage for yourself and problem solve, because you're going to have those ebbs and flows. You're going to have times where your kid's not sleeping. You're going to have times where you have an injury or you had too much protein and you got to deal with that. Like it's how you kind of come out of those situations and navigate them. And what's interesting, the point of life that I'm in right now, and you're getting close, is, your kids are getting a little bit older and you're like, okay, so I'm in this pregnancy postpartum space, but personally I'm looking forward to, peri and menopause. And you thought postpartum was a shit show. It's bad. It's really bad.
I hear, I'm like, is this the trend of where my career is going to go? Just going to
buckle up, honey. That's where we're going next.
I know. I mean, I'm so aware, and it's, I'm 37 and so far, like nothing, but I am like talking to my doctor, like, I want to get a baseline of where my hormones are at right now, because I know that shit's about to change.
Get yourself some vaginal estrogen, my dear. Like, start there. I mean, I remember you had Stacey Sims on, I think it was a couple of years ago now. And, I feel like, again, the vocalness that our generation, I think that have gone through things. I'm about to be 47, so I'm a little bit ahead, but I feel like we're kind of moving through life similarly. The vocalness and the advocacy that we have had to find for ourselves, we're going to need to do it again.
Yeah.
And the nice thing is we're rehearsed at it and hopefully not too tired. And hopefully we've got some more researchers and things on board. And just by the looks of the female athlete conference that was in Boston last weekend, things are looking better in that direction. But it just, there's just more work to do.
Yeah.
And I'm okay with that.
Yeah.
I'm okay with that.
We're accustomed to it now. I don't think we're going anywhere. There's one question I wanted to ask
Yeah.
you. It's actually what sparked wanting to bring you on the podcast again.
Yeah.
Was when somebody has been diagnosed with prolapse, they're often, and sometimes that can be by their PT, sometimes it's by their OBGYN,
Yeah.
usually OBGYN to then maybe pelvic PT if they actually get a referral there. I want you to touch on A, when a referral is needed,
Yep.
B, insurance, and C, a prescription for a pessary. And of course, this is all like US based information.
Yes.
So if you're listening from another country, take it for a grain of salt. Obviously, things are probably very different for you there. But based on those three, I'd like to call them barriers that people experience when they're navigating changes to their pelvic health.
Okay. All of those have, I'm going to preface by saying there's a bunch of assumptions that you've got to check before people come in. Typically, prolapse diagnosis will come one of two ways. It will either come because the person has noticed it themselves and then consulted Dr. Google, or they have seen their friendly OB or the pelvic floor provider who happened to just mention offhand something, and that person did not have any symptoms.
Yeah.
Those are two.
What would be something that they notice that would make them think that they have a prolapse, for those who do not know what prolapse is?
Sure. So that I love that conversation, because like those of us with prolapse, if you know, like people are like, oh, do I have? I'm like, trust me, you would know. Like typically it's heaviness or pressure. It may or may not fluctuate with activity or constipation. Sometimes it feels like a tampon is just kind of hanging out and floating around. Sometimes you feel like something bulging out of either your vagina or your rectum, typically your vagina. Sometimes you can actually feel something. The assumptions that are there, and I want to preface that by saying this is something that we have learned more in the last few years. This is not how we used to treat it. That the grade or the severity, the grade meaning measuring how much it is out of your body. 1 or 2 is just to the opening, 2 and beyond. And there's different scales. There's 3 out of 3 and then out of 4. Those are basically out of your body. That can be bladder, uterus, or rectum, or all the above, when you can also have mobility of your urethra.
Okay. And another timeout.
Yep.
If it's actually that organ coming out of your body, or are we seeing something differently?
It's so that usually it's the wall.
I'm asking the questions that people.
No, they're good questions. They're good questions. Yeah. So what you'll see is like different things. Like I do think so they're walls essentially. I got really lucky. I had a fresh cadaver dissection in April, and we don't get to see those very much. And every time I go, I'm like, oh my God, how do we even walk around? Like it's the most beautiful thing. And fresh cadavers are just gorgeous, bright colors. And you really see these delineations, these fascial walls, the vaginal walls, that sort of thing, that you have walls. But if you have like an anterior prolapse, it would be more kind of like the bladder and the anterior wall kind of collapsing down into the vaginal opening. Same thing with posterior. The uterus, you would see the actual kind of cervix start to come down.
Out, but all the other organs collapse into vaginal walls. So what if you're seeing something, what you're most likely seeing, unless it's your uterus,
is the wall,
is the tissue of the wall that's being kind of collapsed into.
Yes, exactly.
I like to make that clarification. People are like, my bladder fell out. And I'm like, probably not. But it might feel like
it. Yeah. No, totally. So
sorry for all those timeouts, but these are
no, I think they're important. They're important. Mm-hmm. And then you can also have a rectal prolapse where the rectum almost like kind of works itself outside the rectum. That's a whole nother animal as well. But what we do know is the severity or the grade does not always equal the symptoms that you have. And I remember always being confused by this. I have a client years ago, lovely woman, came in, very kind of insignificant subjective intake. She mentioned she shoved something back in. I'm like, okay, fine. I lift up the sheet to do the exam and there's basically like a rutabaga on the table. It's her rectum. And I'm like, okay, there's not anything I'm going to do about that. This is surgical. No symptoms other than she had to stuff it in to kind of get out of the way to have a bowel movement.
Oh God. And
And then
are like, what the fuck?
and so this is why you don't look on Google. But then on the other end, I can't tell you how many women that I've seen over the years that they swear they feel something and they go to their OB and the OB is like, I don't see anything. And we'll test them in standing, like lying down, whatever. We don't see anything. And so then they're like, oh, well, I'm crazy. And what we started to realize is like, you very much feel this, but what is it that you're feeling? Is it actually, and this is one of the patterns that we're starting to see is a lot of overactivity, hypersensitivity, that you have this hyper awareness of something being there. And so it's a very slippery slope when people are like, can pelvic floor PT fix my prolapse? My first question is, what do you think fix is? And then we have to go back and look at what their understanding is of organs. And people they have this idea that your organs are in your body like concrete. And then when you start to explain, okay, well, if your bladder's full, it's going to move stuff out of the way. Or if your rectum's full, it's going to move stuff out of the way. Like it's a very kind of like plastic, it moves. It's supposed to move. The goal is not to put it back and it stays static where it was before. The goal is like, you wouldn't have looked if you didn't have symptoms in the first place. So that's typically the goal of therapy. We may not necessarily be able to change position. People that do hyperpressives, that they talk about that. I don't know if that's been truly proven, but you can change those symptoms in a lot of cases. Now, as far as, insurance and referral, there's a lot of misconceptions out there. In all 50 states, you do not, by law, you can see a pelvic floor physical therapist without a physician's order. That said, if you want your insurance to cover it, the insurance, because insurance dictates care, they may have a different rule that is different from state law. So you need to know about your insurance provider. And in some cases, and I know this from working in hospital-based, an evaluation with me in a hospital-based setting, they would bill the insurance company like $1,000 to see me because they had a deal with the insurance company to like, okay, we're only going to pay you 60%. And then your insurance company says to you, okay, I'm only going to pay 80% of allowable and the allowable is this. So the hospital barely got enough to pay me and keep the lights on. You're thinking you're getting a deal because you're only paying your copay and your deductible, which is actually a lot. But then you have people that look at me and they're like, oh, well, you're expensive. I'm like, actually, at the end of the day, it's about the same.
This is why there's such a good argument for cash-based practices, even if it's hard to see that.
All of the providers that I know and trust, save like one or two, have moved out because again, and this is the world we live in. It's about money. And a lot of hospital-based practices are going from an hour to 45 minutes, or they want you to co-treat or be treating multiple patients at the same time. Like that's really hard in pelvic. But I think that the thing to understand is, I hear this a lot. Oh, pelvic PT isn't covered by my insurance. No, if you have PT as part of your coverage, pelvic PT is included in that. And I think also in the States, there's a bill going forward to get better coverage for pregnant postpartum care, including pelvic floor PT. That's what the bill is, not any other pelvic floor provider, for Medicaid and Medicare. So typically insurances, as Medicaid and Medicare goes, they follow that. So that's in the loop there. And then you had another question, pessaries. That has changed since December 2022.
And wait, hold on. What is a pessary?
Okay. Let me reach into my magic box here.
Handy pessary.
All the things. Think, and I don't know if this is like such a 70s thing. Think like a diaphragm, which was birth control back then. Basically, you're putting it up in it. It's a shelf between your pubic bone and your posterior kind of vagina.
Sort of like a menstrual cup sort of phenomenon, right?
Exactly. I actually had a client the other day that we wanted to see if this would be a good idea, and she couldn't even keep a tampon in. I was like, you know what? why don't you try a menstrual disc?
Mm-hmm.
And she did the disc because they're a little bit more broad. And she's like, two things. One, I don't have to worry about extra pads for my flow. And two, it supported her organs because she was having some issues when we had purple air quality because of all the forest fires and that kind of stuff with coughing. So these devices, prior to recently, the people that were prescribing them were primarily GYNs and urogynecologists. So let's take urogynecologist who's a specialist. It's going to take you a couple months to get in to see them. You see them your first visit, then you've got to schedule a fitting, and then you've got to come back again, get that checked. The context in which I would refer someone for pessary fitting, I would want to rule everything else out, or I would have them make the appointment. We would work on the stuff. And if it didn't work out, they kept their appointment. Now we have pelvic floor PTs in the US that basically were like, hey, this is kind of an orthotic, which it really is. And I was trained through the Academy of Pelvic Health PT. And they have a collaboration with a vendor that says, hey, if you've taken this course, we'll give your clients a discount. Like, this is $40. So that's the other thing too.
The need is basically PTs learning how to actually fit them and having the course, going through the course to do that.
Exactly. So how I use them is incredibly different now because there's not this massive barrier to go get fit. So I might have clients that they've got a ton of symptoms early on. OB says, yeah, that's fine. Things can go up there, all good. Let's say mom's got a toddler and she's got symptoms in a new baby. We need to kind of put the kibosh on those symptoms to allow her to do those things that she has to do.
Exercise where there's fever and you're just like, I know it'll give me the extra level of mental support, feeling like things are more secure, like a sports bra for your vagina. That's
exactly. That's totally it.
Is like this, even if it just gives you the mental relief that your vagina is a little bit more supportive, so you're stop being so robotic in your movement, you can just actually freaking move and stop thinking about your vagina, then that alone is enough incentive to use one.
Well, and also when we're thinking about the context of patients, and this one is just for prolapse, and then the ones with the little knobs can be for leakage as well, and the dish can be for prolapse.
So that pushes against the urethra.
Yeah. Mm-hmm. And so here's the thing too, now that we know that there's a subset of people that have symptoms related to overactivity, think about it. If you're freaked out about that falling out or that symptom all the time, you're going to go here more. But if you have something that's supporting that, your brain gets a little bit of a break. It's going to allow us an ability to kind of change strategies. And then we can gradually increase activity and taper off that device.
Ripping, high tension athletes can sort of learn let go without having to actively.
Exactly.
I'm going to relax my pelvic floor now. Which
exactly. So I learned to do the fittings in December of 2022, and how I am considering using them is far sooner. I had a new mom that I think she got fit at like 10, 12 weeks because she was going to Disney. And I was like, okay, first of all, you got balls to go to Disney with a 12-week-old. But she was going to be there with family and friends. And I was like, you know what? I would just pop that sucker in just the whole week. And you don't need to be thinking about that. So just, I think, again, as we get more access to things, we drop these stupid barriers, how we can utilize resources and, things like this can be just much more innovative and supportive for the patient.
So is there like a PSA that goes out to pelvic health PTs? Like, hey, you should take this course so then you can fit your patients for pessary. Like
that would be me. No.
Like, I'm just wondering, like, how do PTs even know that that's like a thing now? Like, how is that communicated?
I will say, okay, so pelvic, that's a bigger question.
That's my own selfish question, right? People on the podcast are probably like, we don't care.
No, so this is, so you're not all pelvic floor PTs and not all PTs are part of their professional association. Okay. The Academy of Pelvic Health PT, they have a PT and a urogynecologist who happen to be local to me here. I've known them for years, decide to put this course forward because the PT, Mary Austin, used to work at Walter Reed and within the military system, and the urogyne that she met there, like all this stuff PTs can do in the military system. And a lot of good things do filter out from there. And so they basically said, hey, we're going to offer this course. They worked out the logistics. And one of the beautiful things about this is they navigate, if you are in a health system, these are going to be the things, the hoops that you have to jump through. It's different hoops than what I have to jump through as far as like sanitation of like sizing kits and, those sorts of things. How do you get equipment? Like there's a lot of logistics that are involved in that. And so I think part of it is being aware of the advocacy that your professional association is doing, and then also being aware that you can use these in different ways, and it would behoove us to be able to have access sooner. So I've been very vocal about my training and my fitting in them, but also understanding too that you have some states that are going to put restrictions on practice acts. And so that's one of the things that was discussed is like, hey, we're going to teach you guys this, but it's ultimately up to you to touch base with your state practice act. And some of them are weird. Like Virginia, we didn't have, like you had to have an order for dry needling up until that's changing July 1st. So when I was in DC, like literally 2 miles away, I didn't need an order for anything. My practice here, all of a sudden I needed all this extra stuff. So that's also for me, again, past president, working a lot with APTA and Academy of Pelvic Health, it's important to support advocacy efforts because it leads to stuff like this that we can move that needle. I know it doesn't feel that way sometimes, but that's one of the ways sometimes that we can push that stuff forward.
Can they petition to their state and say so they can petition, even if it's not currently allowed, they can petition it and maybe get it?
Well, and that's talk about that in there too.
Following you on it, or is there letter of the law and spirit of the law? I don't know.
No, and here's the thing too. And again, like I think if you're in private practice, you understand these things a little bit better. Is like you're never going to have things that delineate 100% of everything. And so what you're looking at is, do we have comparables? There was a whole thing a number of years ago of like, do we need to have a separate order to do an internal assessment? And it's like, a muscle's a muscle. Why should I need extra permission? If you're asking for extra permission, does that imply that you shouldn't be doing it in the first place? So that's like a whole legal thing. But what I will say, because I'm not a lawyer, is in this particular course, they've addressed that and how to go about reaching out to your states and doing it in a way that is most likely to be beneficial to you being able to do that.
Interesting. And it's interesting. And like, the silver lining to me is we've made a lot of freaking progress in a very short time. Like, this is a really big deal. You and I, on your end and my end, have both had people come to us extremely recently saying like, either I can't really get into my Urogyne, or my Urogyne is going to take a long time to get this pessary, and I just really need this pessary because I'm freaking miserable. Like, I cannot lift, I cannot move, I cannot do these things. Their quality of life is being significantly diminished. So we can have some barriers removed, where this is almost like, we don't believe in quick fixes, but like, this is a freaking great quick fix. Like, this is a great quick fix that like we can utilize that improves quality of life. And it doesn't dismiss the work we can do with PT and rehab and progress in the gym. No. It's not replacing that. It's complementing what we can encourage our clients, our patients, our athletes to pursue if they need that, quite literally, extra support.
Well, and here's the other thing, like in this one particular expat situation that we're talking about, it was like, okay, it wouldn't be ethical for me to be like, here, let me just send you this thing without fitting you. Like, but what things do we have that are over the counter that can be indicators
on Amazon, right? Like,
well,
like, I mean,
no, you can. And so that's literally what I sent her. I was like, okay, there's this one, it's like Revive or something like that. There's the Impressa that has a fitting kit. Like, again, last week I had the client that we did the menstrual disc. I was like, and that's where, again, like, I think we've got to have some creativity here. If like, even if we can't get this and we can't fit it right, what are the things that we can do to give you support? I saw another PT. She was recommending putting 2 tampons in instead of 1. I was like, okay, because I've had enough women where you could get 2 tampons up in there. How can we problem solve creatively while we're still working on these barriers? And I think that's the thing is and I was telling this person this morning, like, why I think we resonated so much is we're not willing to take no for an answer, we're like, all right, well, how can we do this? And it's not MacGyvering, but like we're bastardizing what the hell is out there and we're going to make it work. And that's going to drive kind of that next piece so it can be legitimized and can be standard of practice and those sorts of things. So
yeah, I think that's exactly it. It's like being willing to get really creative, and like coaching by nature is a creative, like
it is
vision. Like you got to be able to connect all these different dots. And, 10 years ago, that's when I had that exposure to like, there's so many dots and dots that I didn't know were even dots until like I experienced this firsthand. Before I didn't give a shit. Honestly, and if my birth would have gone like great and my recovery would have been gone great, I still wouldn't give a shit. But it didn't. And it was like such an eye-opening experience to be able to sit and say, okay, there are these significant dots that are connected to women, especially during these particular seasons that aren't just about these seasons. These can really kind of make or break what the lifetime of athleticism looks like. It's not even just about pregnancy or diastasis or prolapse or incontinence. It's about what this means for the quality of life for this person at a functional level, a fitness level, health level, like all these different levels. And yet we get so hyper focused on these seasons or dismissive of these seasons.
Right.
We see both. And there's a lot that we can do by creating awareness, having this education, and then, like we said, just being really creative and, well, what can we do? What is the next right thing? And you've done such a great job of being that resource in your field and kind of combining brains and effort with, this work that I'm doing. And I'm so glad we have each other.
I know. And one of these days we're going to be in the same place.
I'm not going to make it happen because I guess I forget that these people that I've like talked to for so many years online, I like haven't actually met in real life, but it feels like I have.
It does. Yeah, no, totally.
Like I know a decent amount about you in so many ways. And
you do. Yeah.
Thank you for growing up with me in this, my friend. I appreciate it.
Absolutely.
And for having such a good, candid conversation. Like we were talking before we started recording, like I don't have any questions written down, but I know that you and I can riff all day. And I think it's important for people to overhear these conversations that you and I kind of naturally have on the side all the time about why we're mad or what someone just told us. And, the work that we're doing. And I think it's important for people to know what's actually happening behind the scenes, and then A, not feel alone if it's them. And then B, as somebody who like has the privilege and the power and the knowledge to do something differently, like we freaking can and we better.
Well, and to have agency to feel the ability to contribute to the conversation too. Because again, it's not just two of us, it's all of us. It's so many of us that are going to keep moving this needle forward. And long after we're gone, there's more work still to do. So
they got to link up some arms here and just keep trying to change the game for people. So Carrie, where can people contact you, learn from you, work with you? Give us your info.
So I tend to hang out on Instagram. It's a little nicer there. It's at Carrie Pagliano. And then to work with me locally here in the DC metro area or virtually, it's carriepagliano.com.
Okay. And if somebody, say, in a state where they don't have a PT that like, quote, gets them, they want to work with you.
Yeah.
They can work with you. Is that what you're saying? Through virtual PT?
It's one of those things that, again, I try and work with as it's more of a consultant sort of role. We're lucky in the US that we've got a lot of reciprocity with licensure compact and that sort of thing. But my whole thing is, it can't be about me. We've got to make sure that we've got boots on the ground and people that if they're willing to learn, I'm happy to bring them along the way. So
absolutely.
Yeah.
Carrie, thank you for sharing your time. If you want to learn from Carrie, we have another podcast with her that we recorded really early on of like what to expect in a pelvic PT visit, your first visit. That was one of our earlier podcasts. And then Carrie contributed to the coach certification, pregnancy, postpartum athleticism, where we talked about all things pelvic health, but a lot more dialed in on incontinence and types of incontinence and experiences, symptoms, what to do. And same for prolapse, what it is and what we can actually do at an individual level and as coaches to help our clients who are experiencing these pelvic health symptoms. So if that piques your interest, I would love to have you become a pregnancy and postpartum athleticism coach, because we have a lot of great people that contributed to the course with their expertise and knowledge to really create a holistic, well-rounded, evidence-based, but practical application of, women's health for pregnancy and postpartum athleticism. Thanks for being here, Carrie.
Thanks for having me.
Thank you so much for listening to this episode of the Practice Brave podcast. If you enjoyed the show, please leave a review and help us spread the work we are doing to improve the overall information and messaging in the fitness industry and beyond. Now, if you are pregnant and you are looking for a trustworthy exercise program to follow, I have you covered. The Pregnant Athlete Training Program is a well-rounded program for pregnancy with workouts for each week that are appropriate for your changing body. That's 36 weeks of workouts, 3 to 4 workouts each week, and tons of guidance on exercise strategy. We also have an at-home version of that program. If you are postpartum and you're looking for an exercise program to follow, the 8-week postpartum athlete training program would be a really great way to help bridge the gap between rehab and the fitness you actually want to do. From there, we have the Practice Brave Fitness program, which is an ongoing strength and conditioning program where you get new workouts each week and have a lot of guidance from myself and my co-coach, Heather Osby. This is the only way that I'm really offering ongoing coaching at this point in time. If you have ever considered becoming a certified pregnancy and postpartum athleticism coach, I would love to have you join us. Pregnancy and Postpartum Athleticism is a self-paced online certification course that will up-level your coaching skills and help connect the dots between pelvic health and long-term athletic performance, especially during pregnancy and postpartum. Become who you needed and become who your online and local community needs by becoming a certified pregnancy and postpartum athleticism coach. Thank you again for listening to the Practice Brave podcast. I appreciate you, and please help me continue spreading this messaging, this information, and this work.